This portion of Local Lifestyles is brought to you by UVet.
Dr. Jimmy Yu of UVet in Newburgh is here to really shine some light on what is really a problem, not just for people, but for animals as well, and that is stroke. You don't normally think about, no, you do because you see it all the time, but about animals having stroke. So what are the signs? What would a pet owner notice?
So, people, we heard about stroke, happen. Pets is not as common, but they could still, get it. So basically, stroke is, we know it's a blood clot, and for whatever reason it is, it's a circulation problem. And usually those happen in the forebrain. And when that happens, you will see, kind of different kind of sign. Some pet will be kind of circle, some pet maybe, tilt their head. Some pet maybe kind of, maybe just not, you just see they are just not doing right. And a lot of time you could see that their eye alignment is different or pupil in different sizes. That could also represent that. So they, they could have different kind of symptoms. Just depends on which, part of the brain they have, blood clot.
Do they have sagging muscles in face and limbs as well, like people do?
That's possible too, yes. Especially if this happen in some time. Sometimes we say there's a microstroke, which is people didn't even know it happened, no witness. And then it had been a while afterwards, and you will see some muscle, they kind of, really weak or atrophy. And like there's no more muscle mass, or you see one side of muscle mass is big, bigger than the other side, the other side is smaller, something like that. That could happen too. And so in some, stroke is really, you saw it, or you know there's something going on, because even if you didn't witness it, but you see the dog, your pets just kind of act different. That's the other thing too.
So how do you treat an animal that's had a stroke?
Yeah, so actually first, we need to gather enough history, and then we do our thorough exam. After that, if we believe it could relate to stroke, usually we like to also run tests. We like to draw blood, and sometimes we may need, either X-ray or ultrasound or CT MRI, if we try to find if they still, even if a stroke is an event, but there's continued, bleeding issue, things like that. And also good to know that history, if pet is taking any, any medicine, because some medicine could contribute to stroke too. And there are medicine like aspirin, people are taking themselves, maybe there's some people just give aspirin to their pets, and that need to be known too. And so based on that, then we could decide what kind of treatment plan we have.
Do strokes happen more commonly in older pets? Like when we think of our older population of people, does age matter?
Absolutely, yeah. Age does, matter, the most. And the other thing is, some pets had some younger pet, if they are congenital, like a cardiovascular issue, they could be contributed. So it could happen in young age. It just, majority is usually happen in the older one.
Is there a therapy for our pets?
Yeah, there are therapy available, and basically, like I say, what kind of therapy is available for your pets, it depends on, is stroke is the only presentation or there is some other thing. So it really depends on the exam, the condition of the pets, and also the test result to decide.
That's why you come to see a veterinarian like Dr. Jimmy Yu. More Lifestyles right after this.
This portion of Local Lifestyles is brought to you by UVet.